Cardiology patient diagnosis and plan of care. Subjective data. The patient is a 52-year-old male who presents with fatigue after being hospitalized for 2 weeks for stent placement. Chief complaint: the patient states that his heart has been racing. History of present illness: the man is physically active. He had palpitations caused by exercise. 2 days ago, the patient experienced shortness of breath on exertion and an elevated heart rate that did not decrease with rest. Smoked 15 packs a year for 20 years. Past medical and surgical history: the man was diagnosed with rheumatic heart disease in childhood. The patient was diagnosed with hypertension 10 years ago and hyperlipidemia 5 years ago. Post-coronary stenting. The patient has been following a low cholesterol diet for the last 2 weeks. Significant family and social history: non-contributory. Objective data. Vital signs: blood pressure 160/90, heart rate 146, respiratory rate 22, temperature 98.6 degrees Fahrenheit, weight 254, height 5 feet 7 inches. Physical assessment findings. Head, eyes, ears, nose, and throat: pupils equal, round and reactive to light, jugular venous distension, mild arteriovenous nicking. Heart, irregular rate, murmurs and gallops are absent. Abdomen, soft, non-tender with the presence of active bowel sounds. Extremities and pulses: no edema, pulses are normal. Neurologic, alert and oriented to person, place, and time. Laboratory and diagnostic test results: sodium 136, potassium 4.5, chloride 97, blood urea nitrogen 20, creatinine 1.2, total cholesterol 240, triglycerides 180, INR 1.1. Chest X-ray, clear. ECG, atrial fibrillation, no P waves, variable RR interval, normal QRS. Assessment. Atrial fibrillation, 148.91. The first differential diagnosis for the patient is atrial fibrillation, which is an extremely prevalent sustained cardiac arrhythmia with a rate of prevalence approaching 2%. The condition is strongly associated with hypertension and coronary heart disease. According to Manolis et al., hypertension per se increases the risk of atrial fibrillation by about 2-fold. The patient has reported shortness of breath on exertion, which is associated with the disease. Other symptoms of the condition that are present in the patient include palpitations, lightheadedness, and generalized weakness. Most importantly, ECG confirmed the diagnosis. Heart failure, 428.9. The second differential diagnosis for the patient is heart failure. According to the definition provided in ESC Guidelines for the diagnosis of the condition, heart failure is an abnormality of cardiac structure or function leading to failure of the heart to deliver oxygen at a rate commensurate with the requirements of the metabolizing tissues. Abnormalities of heart rhythm, underlying cardiac problems, elevated pressure, minor retinal abnormalities, and breathlessness, among others, are symptoms of the disease. Myocardial infarction, 121.3. Myocardial infarction, MI, is the third differential diagnosis for the patient. According to Gara et al., almost 30% of patients do not experience chest pain during the onset of MI, therefore, other symptoms present in the patient can be attributed to the disease. Plan of care. Atrial fibrillation. Novel oral anticoagulants are known to reduce stroke risk. Taking into consideration the fact that the patient does not fall in a low-risk category, he cannot be prescribed aspirin-clopidogrel combination therapy. Instead, it is recommended to treat the patient with 20 mg of rivaroxaban for 30 days to reduce stroke risk. Heart failure. The man should be immediately hospitalized. The patient has to be treated with an ACE inhibitor, an MRA, and a beta blocker in conjunction with a diuretic. Myocardial infarction. Hospitalization is necessary. Given that the condition is associated with an extremely high morbidity rate, it is important to restore perfusion in a very rapid manner. Before starting the treatment, healthcare professionals have to distinguish between STEMI and STEMI and consider different pharmacological options. The use of oral ACE inhibitors is recommended.